Hello, I'm Solomay Tibabu, the host of the Going Digital Behavioral Health Tech Conference. I'm so excited to have Dr. Reena Pande, CMO of AbleTo. Thank you so much for joining us.
Thank you for having me. Such a pleasure to be with you.
Can you tell us a little bit about your background and your role at AbleTo, and what is AbleTo for that matter?
Yeah, for sure. So I'm AbleTo's Chief Medical Officer. I've been here, we're going on 8 years in this role. It's hard to believe. I feel like a veteran. I came to this work though, Solomay, as you'll remember, and as some people know from academia, and actually as a cardiologist, not a behavioral health clinician by background, but saw firsthand how very often my patients with physical health conditions like heart disease, diabetes, what have you, were suffering from mental health challenges that were frankly going completely unaddressed and were proving to be a barrier to what we were trying to accomplish together. And I just saw an opportunity to do better, thinking about behavioral health, integrating behavioral health properly with physical health needs, and then making sure patients had access to evidence-based, high quality, easy to access. I could throw a whole lot more adjectives or phrases at you, but all those things were, I couldn't find those things. And it seemed like using technology to get access to really good integrated behavioral health care was a huge gap that I was excited to have the opportunity to fill. So it's been a joy. That gives you a little bit about the AbleTo work. You can hear all those really important adjectives about ensuring high quality evidence-based care for patients now across quite a broader spectrum of mental health conditions that we treat. We can get into more details, but it gives you a little bit of the background.
Great, thanks so much. So over the last year, virtual therapy has definitely had its moment with usage more than doubling during the pandemic. Do you think it's here to stay? And what are the next challenges for mental health?
Yeah. Oh, yeah. I think in mental health in particular, it's here to stay. What I've been hearing from our health plan partners and from physician and other clinician colleagues in the space or in healthcare broadly is that telehealth utilization has started to peter for non-mental health conditions, but that it has stayed quite high for mental health, which is really interesting. And I think we'll see that persist post-COVID for mental health in ways that we don't see persist for physical health conditions. So really interesting observations that we're seeing as the pandemic starts to wane, the impact that it has on telehealth.
And with that, there's also been a boom in mental health apps out there, like in over 10,000 now and climbing each day. But AbleTo has really been a pioneer in this space over 10 years plus. What are your thoughts on how the space has evolved?
Yeah, it's so fun to watch and to think back. As noted at the beginning, that it's been 8 years for me at AbleTo, which is just incredible. I mean, back when we started, this is going to sound awful, but no one really cared about mental health. I say that with a little sadness. I mean, as a physician, it was sort of it was siloed. Hopefully someone took care of my patients' mental health issues. As payers, the payment models were siloed with behavioral health carve-outs. There was starting to get some traction, but back in 2013 when I joined, there was not a lot of people paying attention. So it's just been a joy to watch the space grow and develop, and to see all these wonderful companies grow, and for there to be so much interest and excitement from payers and providers and employers and patients for that matter. I think that stigma is still an issue, but there are many more people just talking about mental health, which has been great. I'll answer the question. Actually, you asked me before, but I don't think I answered it, which is, what do I think are the next challenges? I think this is the challenge right now. There's tens of thousands of apps. There's everybody's saying, I can solve your problems. There's inconsistent quality. There's some wonderful and a very high quality solutions, but others not so much. And it's like a trillion little puzzle pieces. And so others have heard me say this, but some of our clients have told us, we have point solution fatigue. How do we pick? How do we know which are good? How do we know what's evidence-based? How do we know what's high quality? How do we put those puzzle pieces together? And I think that's the challenge the space now faces, is so how do we make sure it's high quality, evidence-based, But then how do we pick and put the right solutions together to meet the needs of a broad spectrum of patients with clinical needs?
That's really interesting. How is AbleTo addressing this?
Yeah, it's such a great question, Solomé. I mean, we've noticed that we needed to be a leader in pulling those puzzle pieces together. I like that puzzle analogy because I feel like it's not too many people are sort of saying my puzzle piece will solve all your problems. There's no one panacea, right? You know this as well as I do, that mental health is really a heterogeneous set of conditions. Depression is not anxiety, is not OCD, is not psychosis, is not SMI, right? It's a widespread, and we need to be thoughtful about making sure we're honest about that. We're honest about what we can do well and what we don't do, and kind of put the pieces together. So at AbleTo, to answer your question, we've been thinking about this a long time. So you'll remember that a couple of years ago, now more than 2 years ago, we acquired a wonderful company named Joyable to make a more digitally focused intervention available for individuals on the kind of lighter intensity need. And then actually built out an intermediate solution that was a very high quality therapy for, I'll call it, run-of-the-mill is not the right adjective, but run-of-the-mill depression, anxiety, acute stress disorder, with a digital complement to that human-to-human element. Everything we do is a combo of people plus technology. And then on the highest intensity end of the spectrum is most people know us for kind of our traditional solution, which was always geared to those with comorbid physical and mental health conditions. But then the challenge is, how do you figure out who needs what? And so we're actually just launching our AbleTo Connect, which is the ability to, in a very clinically and evidence-based way, assess an individual digitally and then triage them or guide them to the optimal solution within our set of solutions. So you can sort of hear the puzzle pieces starting to come together, and then the ability to point a patient to the right intervention that meets their clinical need, that they're most likely to engage with, that they're most likely to adhere to, and ultimately, of course, to see a really good clinical outcome. So I think that's where the world is going, right? And consolidation is a really boring term, but I think that's what the space needs now that there's this explosion. The leaders have to kind of pull those puzzle pieces together and make it easy for our patients, for our partners, whether they're employers or health plans or providers. Totally. Sorry, you got me on my soapbox. That was a long answer to your question, but I love where we're headed and how we're tackling that.
Oh, that's great. That seems to be a theme that comes up with the health plans at the conferences. There are so many solutions and disjointed. And so it sounds like a really thoughtful approach that AbleTo is taking in terms of having that connectivity and thoughtfulness around the entire platform. And on that note, so the adoption of technology has transformed not only the way people access care, but also the way therapists and coaches really connect to patients. Mm-hmm. Can you talk a little bit about that and how technology has helped?
Yeah, I mean, it's just been such a dramatic move forward. COVID certainly accelerated the utilization of technology for therapists and other behavioral health clinicians. I think tech has let us do a lot of things. I mean, first off, I like to say tech really is not a panacea. I mean, there's too much sort of leaning on tech to solve all of our ails. You know me really well, and you know I'm a believer that people still need people. And for me, it's that human connection, I think, is so important. But tech, you know, I've been part of a tech-enabled company for many, many years now. I think it's just trying to figure out what proportion of tech and what proportion of human is right for the person that's in front of you, and being honest about it. There are places where predominantly digital solution is absolutely all you need, often with a coach to complement that digital solution to ensure adherence and good efficacy. But there are places where people still need human interaction. And tech can support that through telehealth. And then tech can also enable quality oversight and measurement and an assurance of fidelity to clinical protocols and evidence-based guidelines. I like to say, like, a bad provider using tech telehealth to deliver care is still a bad provider. I mean, that's true of cardiologists, that's true of whatever specialty. This is not about behavioral health. So tech is not, in that way, tech is not a panacea, right? You can't just like deliver bad care via technology and miraculously make it better care. But there's great opportunity to utilize technologies to ensure that care is being delivered with fidelity to evidence-based protocols. There's magic that you can apply. You can collect data, you can deliver measurement-based care, you can learn from a member or patient or an employee, and then you can utilize those learnings to adjust your care in a specific way to make sure you're optimizing and meeting the patient's needs. So there's real opportunity to kind of marry technology and people together in the right, I like the word aliquots, in the right proportions, right, to meet the patient's needs.
You mentioned member versus employee.
Yeah. I
the differences?
Utilize the words like interchangeably. Frankly, I mostly call everybody a patient because I can't get out of my I'm a clinician lingo. But you know, the same human being is defined differently depending on the lens you use, right? So the employers are going to think about that person as an employee. Our payer partners will think of them as member. I think of them as patients. In the end, they're just a human being that's seeking care, and we just want to make sure we're finding them the right care. Labels are just labels ultimately, right?
Yes. So here's a bonus question.
Okay.
You have been like the OG CMO for behavioral care startup, and we have a lot of emerging startups in the audience. One of our partners is Well Digital, an organization for women in academia who are making the transition into leadership roles at a digital health startup, mostly in the mental health realm. And do you have any advice for emerging CMOs out there?
If we had hours, I could give you all my advice. So I guess first I'll say, if people need advice, I'm always, my virtual door, it's a virtual door these days, is always open. I adore talking to younger and frankly even older clinicians, physicians, other types of professionals that are looking to make a jump. I made a big shift in my career. It wasn't easy. I broke some hearts in doing so. There's wonderful relationship analogies to talk about leaving a path and moving to another one. I have zero regrets. I've loved everything I've done. I think if I were to give advice, a couple of things. One would be just don't be afraid to try. I think we tend to be risk averse as clinicians. We've been down this really, really, really long road. And then to go, you know what, I might shift to a different path is pretty scary. So, but it's important that we all ask ourselves, you know, what we're really good at, number one. Number two, what impact we want to make, right? And then number three, am I in the right environment to have that impact? And I loved my prior work. It wouldn't be disingenuous at all to say that. I have a huge place in my heart for Brigham and Women's Hospital where I trained, but it wasn't the place where I was going to make my mark in the world. And I think there are a lot of people who don't ask themselves those hard questions and figure that out. And then, I mean, there's so much advice. I probably could speak for hours and hours and hours. I think finding the right people to work with, I have been very fortunate to have found really great mentors at AbleTo and also outside of AbleTo. I tell folks I have a personal board of directors, and the composition of that board has shifted over the years based on my need. When I was in academia, it was a very narrow group, but very academically focused. And as I stepped out of that world, I had to find mentors who could guide me on this new journey. And that took some work. But I've had those people. Some of them have been on this board a really, really long time. You know, those people know who they are. They get calls from me periodically. And some people have woven in and out. And having people that you know and trust and can lean on to answer your questions, you know, how much equity should I be getting? Like, what should my options be? What percent of the cap table should I be on? What should a salary look like? I didn't know those things when I jumped into the entrepreneurial world. And I'm very grateful for people in my circle who were able to help me navigate some of those challenges. So anyway, I'm happy to be that person for people. Folks who have been introduced to me know that I absolutely adore kind of helping folks navigate that experience. So I'm afraid now I'm going to get a trillion calls after this conversation, but that would make me happy. And sorry, one more point. Women and entrepreneurship and leadership. We actually launched an employee resource group at AbleTo, which was my baby. I've been dreaming about doing this for a long time, to focus on empowering women leaders in healthcare. And I have a wonderful team who have stepped up to run this employee resource group internally. It's, there's so many wonderful women leaders out there. It's not always easy though. And I've been very fortunate to have wonderful male and female mentors. And I want to kind of be in a position to help my, the next generation of women leaders be elevated to see a similar success to which, I've been able to see.
Well, we are all grateful that you took that risk as well. Certainly been an inspiration for many.
Thank you.
So access continues to be a barrier for many, especially in underserved communities where even acknowledging mental health is a challenge due to stigma and other issues. What are your thoughts on this need?
Yeah, it's I keep saying it's a wonderful question. All your questions have been great. This one is near and dear to me personally, but also to our work at AbleTo, and I've been so excited to see so many organizations, new organizations, really try to tackle ensuring that mental health is delivered in an equitable way and in a culturally competent way. For our clinicians, we're very focused on that, ensuring that they know how to address race and race trauma, racial stress, issues that may be specific to individuals identifying as LGBTQ+. We made sure in the wake of the violence, or the not new violence, but newly seen violence against Asian Americans and Pacific Islanders, that our providers had the right resources to be able to address their needs in a culturally competent way, and recognizing that, in different cultures, the stigma is very different. I mean, coming from a South Asian family, the stigma in our not in our family, but in our community persists and has diminished, which is great. And certainly in my family, that's true, and I'm proud of that. But it's still an issue for so many families to not even be able to talk about mental health. So I think there's a lot of opportunity to do better. And the other thing, just to add, we think a lot about is equity across socioeconomic strata. And we've been very focused on making sure our care is available as a covered benefit, whether it's commercial payers, but Medicare, Medicaid, so that all spectrum of individuals with socioeconomic needs can have access to high quality care. Versus, there's a place for consumer-directed work, not to say there isn't, but I worry that we continue to perpetuate existing inequities. We need to make sure that as we have these wonderful solutions and a lot of money is pouring into the space, that we think about ensuring care is delivered equitably across populations.
Yes, absolutely. Another now more than ever. It's time. So that's really great.
Absolutely. Yeah, absolutely.
And now, where do you think the future of behavioral health is going?
Oh my gosh, such a big question. Credit to you. First of all, I'll just turn it around to you. I think thinking about this conference, even going digital, it's a sign. That this has become, in just its second year, a premier place for leaders in behavioral health to speak and to share their thoughts. Just the types and the quality of the speakers that you've been able to garner says a lot about where the space is and where it's going. People care about behavioral health right now. Payers care. You have some very seasoned and senior payer executives speaking. And I think that says a lot. There's a desire to integrate at the employer level. I think provider organizations are continuing to figure out how to integrate behavioral health. So much money in VC and and private equity, and frankly in the public markets now, pouring into behavioral health. So I think there's continued excitement for the near term, which is awesome. That's how it should be. And I used the word consolidation earlier, which is, I keep picking these boring words, scale and consolidation, right? Like we have to continue to be able to scale and continue to deliver really high quality at scale, which we're proud to be doing. And we have to pull the pieces together. And I think that's where the space will go. Like the excitement won't tamp down, but reality will hit, and we'll have to put it together in a model, a care delivery model that's comprehensive, that's integrated into physical health, and that can really broadly meet the needs of patients who have mental health needs.
Absolutely. As if we didn't already have to do that before the pandemic, and now effects of that have only magnified the need.
Yeah, for sure. I think the tail of the pandemic with respect to the mental health impact will be long. We have some historical experience with MERS and SARS. People forget that there have been pandemics in our lifetime, and there is some historical experience with the mental health impact. It wasn't in the US, so we wouldn't have to think about it here, but other countries have had to think about it. And I think we'll see the long tail of the mental health impact of this pandemic for years to come. Ourselves and our children who have had a very dramatic difference in their experience. And I think it'll be really interesting to see how the kids grow and what impact this year has on our young ones.
Well, Dr. Pande, this has been so wonderful, as always. I only wish we had more time. Thank you so much for sharing your expertise with us, and really appreciate it, as always.
Salome, thank you. And thank you for putting together this wonderful conference. Such a remarkable group of speakers, and it says a lot about where we are as a space and how much we have accomplished, how much we still have to accomplish, but wonderful to see so many different stakeholders come together to really tackle this issue. So thank you. Appreciate you having me.